Every day, an average of more than 360,000 babies are born around the world, and giving birth is both an ordinary and extraordinary experience. And experts say that after giving birth, that some mood changes are completely normal, but more severe or persistent changes could mean the mother has postpartum depression. A recent study is shedding light on how, when, and where it potentially begins. And the study published in Science Advances suggests some signs of postpartum depression may actually start before the baby is born. The researchers say some women with postpartum depression in this small study experience significant crane changes during pregnancy, finding that some moms with symptoms of depression 1 month after giving birth also had increases in changes in an area of the brain that play a key role in emotional processing. Women who rated their childbirth experience as difficult or stressful also showed major changes in the area of the brain that helps regulate emotion. So here with me today to talk about all of this is psychiatrist and immunologist Dr. Adjoa Smalls-Monty, and parenting expert and certified parenting and life coach Erica Suter. Thank you both for being here. Dr. Adjoa, I want to start with you. Break down some of the key takeaways from this study.
So the study is very important because it looked at two regions of the brain that we know have a role in fear, anxiety, and how we process emotional cues, and that's the amygdala and the hippocampus. This is the first study that looked at the amygdala and the hippocampus in pregnant women. And what this study showed is that you had an increase in the size of the amygdala, the part of the brain that regulates fear, and the part of the brain that controls memories, which is the hippocampus. So specifically what they found is in women that had depression, they had an increase in the size of the amygdala. And in the women that had adverse birth experiences, they had an increase in the size of the brain and the part of the brain, the hippocampus, that regulates emotion. What this means exactly, we're not exactly sure, but it is our first clue that these changes are there, and we should maybe look more into these and how we are treating women and how we're thinking about treatment models.
And so, Erica, we were talking about this. You were on GMA earlier doing another segment, and we were saying we were excited to talk about this because this study provides some sort of proof to what we know about the changes a woman undergoes during pregnancy. And it is more than just the baby blues, but this shows us what's happening.
It's very validating because still in our culture, we don't always take postpartum depression seriously. Even by calling it baby blues sounds like something you should be able to shake off. So many women are told, this is the happiest time of your life. Why are you so sad? You shouldn't feel this way. So to know that there is scientific evidence that backs up that we don't just go through physical changes, but we're going through neurological changes, it is an amazing leap forward for expecting moms.
And Dr. Adjoa, I want to ask you to expand on that, because postpartum depression is a real and serious condition, but some women may feel dismissed, or as we've said, is just having the baby blues. Could this study help change the way we look at women and the facets of depression both before and after giving birth?
Yes, you're exactly right. Baby blues does occur. And that might be when someone is feeling a little bit anxious or irritable. It lasts for a week or two. But postpartum depression or even peripartum depression while you're pregnant is very serious. And that is more severe loss of interest in yourself, the baby. People might feel guilt. And in the most extreme cases that I sometimes see in the emergency room are people that feel like they don't want to live, or even their child, because of the severe depression. So it's very important that we recognize scientifically something is happening. This is just not a decrease in someone's will or regular lack of energy, being overwhelmed. Something is actually happening that we do need to address medically. And the good thing is that there are treatments available for postpartum depression and depression during pregnancy.
And Erica, you say that the brain, the body prepares and changes a woman for motherhood in a similar way that puberty changes the minds of adolescents. Can you explain that?
Right. We actually call it matrescence. It's knowing that there's full body changes that are going on, like in puberty. It prepares the adolescent brain for become an adult and make adult decisions. Well, the same thing with matrescence. We have to acknowledge that we go through these crazy changes, and it may not seem rational, it may not seem normal, but it is what it is. And having a study like like this, my hope is that we can highlight some of the people who are at risk before the symptoms start to show, and that women can get help early on so that they're not suffering in silence, because a lot of women are.
Yeah, and this study helps it bring it to light and allow us to have the conversation, but more studies definitely need to be done. Erica Suter and Dr. Adjoa Smalls-Monti, thank you both so much for being with us.